artificial intelligence-supported technologies in daily prosthodontics. We are standing at the edge of a massive transformation in the dental industry, driven entirely by artificial intelligence. Today, we are going to explore how these digital tools are not just a futuristic concept, but practical technologies that we can integrate into our daily practice. And I'm using digital dentistry since 2013. 30 years, my main focus was chairside applications. And chairside applications require less time for a more productive and increasing the patient's benefits. And reaching the treatment goal is the most important aspect of a chairside digital dental practice. This is my playbook. I have several intro scanners. I have 3D printers. I have milling machine. I'm integrating my workflow to my daily routine in order to reach out my best potential about treating my patients. And also, I wanted to use every technology as good as possible. Having said that, we should understand first where the dentistry is going, and we have to look at how industry as a whole has evolved. We have moved from first industrial revolution of mechanization and steam power to mass production into the era of computer automation. Today we are in the fourth revolution, the era of cyber-physical systems. Think about how we consume music. We went from vinyl records to cassette tapes, which I have started listening to music, to CDs, to iPod, and finally to entirely cloud-based streaming like Spotify and other streaming services. What has changed? The music, the melody, and the notes did not change as the human biology, as the needs of the patients, except having everything best in the least amount of time. But what has changed is the medium. The medium is the message. When it comes to streaming, we tend to use easily replaceable, reproducible, and also foreseeable restorations in the shortest amount of time. We have 4 dental megatrends in the year 2026, which are artificial intelligence, the big data, the 3D printing, and also the ecological sustainability. Today, we're going to deep dive into artificial intelligence and a little bit of 3D printing and also subtractive technologies. Artificial intelligence has been first defined by John McCarthy in terms of the name artificial intelligence. The concept has been defined by Alan Turing back in 1950s, in the start of 1950s. The computers started to be used. But artificial intelligence has been defined by John McCarthy. What is artificial intelligence? Artificial intelligence is a set of different layers of intelligence, which are machine learning, the deep learning, and discriminative and the generative AI. When it comes to machine learning is the ability of a computer, of a software to learn autonomously. Deep learning is a subgroup of machine learning implemented via multi-layered neural networks, and they can find patterns in large amounts of unstructured and heterogeneous data. To give an example, if we teach the algorithm to differentiate a radiograph from a photograph, an X-ray, a tomogram, the computer can recognize that this is a panoramic radiograph of a jaw and can understand, if we supervise and teach it, where the teeth are. The second thing is neural networking. It's a machine learning program or model that makes decisions in a manner similar to the human brain by using processes that mimic the way we think, the way the biological neurons make connections. When we take a look in the X-ray, we can differentiate the tooth from the implant, right? So, understanding which one is the implant and which one is the tooth, it's kind of using the neural networking. The final and most important is the deep learning. It is the decision process of any given artificial intelligence. It focuses on modeling and solving complex problems. It not does only recognize what we have provided, it can give us an assumption of being an aid for diagnostics, like weight advice for having a caries, a periodontal lesion, or periodontitis risk. This is deep learning. Also, deep learning can be used in different levels and models. I'm going to talk about that, but to give you a very interesting example, it is possible to convert a video to a 3D model, an STL model, to define the skin bodies with the help of deep learning and making a mesh extraction. everything starts with why. Why should we use artificial intelligence? Artificial intelligence is not our aim. Digitalization is not our aim. It has been defined as an aid, and this aid starts with the diagnostics. Being an expert in any type of profession can create a tunnel vision. I'm a prosthetist. And when I start seeing my patients, when I start my critical thinking, I tend to see the case as a prosthodontic case. But a general anatomist in the clinical aspect, patient can need different levels of treatments, and we have to be very careful about our diagnostic approach. AI can help us with creating a kind of a roadmap and creating a kind of a checklist for the diagnostic appointment. It can analyze dental x-rays, CBCT scans, intraoral images to detect issues like cavities, root fractures, bone loss, and pathology more accurately. At least it can create some attention to us so that we can concentrate on the issues and we can make a thorough diagnosis, more accurate diagnosis in the less amount of time. When it comes to treatment planning, especially for implantology, for prosthetic-driven implant restoration or rehabilitations, we need the virtual patient. We need to segment the CBCT data and also align this data with the intraoral scan. The artificial intelligence can help us segmenting this data, having a more clear form of the three-dimensional model of the jaw so that we can plan positioning of the implants according to the prosthetic plan. And also, we can achieve a high degree of precision. We can make a plan regarding all the anatomical landmarks which can cause trouble during the procedure. We have to protect, like the infraocular canal nerve or the maxillary sinus. All of them can be easily detected, can be segmented, and so that we can plan not only for prosthetic way, but also in anatomical way, like a centralized version of making the decision. I like this study a lot, and it gives a feeling about how can we use and why should we use artificial intelligence. It's about the accuracy and the time efficiency of artificial intelligence-driven segmentation on CBCT images. It's a validation study using two different implant planning software programs compared to human intelligence by dose. As you can see, the AI-driven segmentation with the co-diagnostics and blue sky plan are comparable to manual segmentation in terms of root mean square discrepancy. And when it comes to different sets of teeth, like incisors, canines, premolars, and molars, we can still see that AI-driven segmentation is comparable to manual segmentation. We don't have any significant differences. But when it comes to consuming time to do this process, manual segmentation takes more or less 15 to 18 minutes more compared to artificial intelligence. Why is it important? I'd rather to have more time to think about the patient, to think about the plan of the patient, instead of spending this time for segmenting with the data, to clean up the data. Instead of that, we can concentrate on the problem and the solution as well. This is why we can use the artificial intelligence as an aid. This is very important. And when I get this time to be used for the prosthetic part and also the treatment part, we are going to benefit from that. Very interesting study by Algarba has shown that artificial intelligence is shown to be better than human intelligence in terms of choosing the right place, locating the implant, regarding anatomical landmarks in relation to the vital structures. But please remember that artificial intelligence is not the aim, is not the final point. It can plan where to put the implant, maybe better than human intelligence, but in the end, a clinician is responsible and also is the one who is holding the handpiece and inserting the implant into the zone. And the offset amount of the surgical guide will end up with a little bit of deviation from the plan. We should see the AI and all the digital tools as an aid for our full process. But this aid is very important. This is a real patient, it's a patient of mine, and we have done a segmentation with the help of the artificial intelligence to understand the positioning of the third molar, because she had a lot of issues with this third molar, and what we have seen is what we cannot see in a two-dimensional X-ray. The third molar, the right-hand lower jaw, and the third molar with 3 roots, and in between these 3 roots, we had an inferior ulnar nerve. With this information, and when you have the planning for that, now you know how to separate the roots, how to approach in the rightest angle to take the tooth out without giving any harm to the vital structures and also to the surrounding tissues. Our patient had a very, very minimal traumatic operation, and she did not go with swelling or pain because of a good plan. Plan ended up with a good and true practice for my patient. AI is an aid since 1955, also for impressions. When it comes to digitalization, everything starts with the intro scans. Our aim with impression is to have the trueness and also the precision, which is going to define the accuracy of any given impression and also the accuracy of fit of any given restoration. I love the knowledge of the watch industry. It all started with the craftsmanship, the artisanship, and in the 70s, the industry has changed to fast technology. It was not that complicated. It was not that artisan, but it was highly precise. So when you adopt technology, is it possible to have more accuracy? Of course, yes. But you have to also combine the accuracy with the artisanship, because we're not doing only the science of dentistry. This is the art and science of dentistry. And when it comes to this digital age, digital era, now we are using the type of gadgets like this smartwatches. They're highly accurate. Actually, they're more than a watch. Like the digital dentistry is more than dentistry. It's a different mindset. It's a different approach. We cannot think conventional, we cannot go conventional with new technologies. The technology is giving us the option to know everything, to plan everything beforehand, before start everything. We can create a virtual patient, we can design the prosthetic design, and then go backwards for minimal invasive practice, minimal invasive treatments, and also the implant position for a better prosthodontic rehabilitation. The AI can help us to making a good scan. When you give an in vitro scanner to my daughter, she can scan perfectly easily, but it should be in the right scan protocol. This is very important. If you're not using the way you are doing it, you cannot create a good model, a reliable model, a true and accurate model. So the main important thing about the impression is to follow the protocol, which has been defined by the producer of any given intro scanner, and also to follow the protocol can be easily done by the help of artificial intelligence. It can guide you with showing the angles, showing the path you have to do, and also artificial intelligence can detect some irregularities and also can adjust and correct your model, the virtual model, instantly. What we have with the digital impression, optical impression, is a surface scan. The surface scan is what we use in any given CAD design software. We have 3 different formats, mostly widely used formats when it comes to different sets of data. We can use the OBJ file, STL file, and PLY file. A PLY file and STL file, standard Tesla language file, and also PLY file is more or less exactly the same. The only difference is the PLY file is the colored version of an STL file. The OBJ version, this OBJ file, is way detailed. And when it comes to see that in a CAD software, like Dentwork, which I'm going to talk a lot today, we can see the difference between OBJ file, STL file, and also PLY files. Let's take a look. When we make a scan, every scanner can produce 2 different types of data sets. One is their native language, and the other one is the universal language. The universal language of the labs and all the software required, STL files and PLY files, mostly. But there's another file, which is also colored. It's called the OBJ file. And as you can see from here, we have different data sets. What is different? The OBJ file is more detailed. And as you can see, more irregularities. The artificial intelligence can see more irregularities, it can also detect the margin line way better. Yes, the artificial intelligence can detect the margin line. As you're seeing now, I have done nothing. All we did was making the impression, upload the scan to the AI-based software, cloud software. And this cloud software has detected the margins automatically. And as you can see from here, we have a minor difference between OBJ file and STL file and PLY file, and the OBJ file is more detailed. The software can detect a very little minority and make the design accordingly. And we are not going to solely rely on the margin line, which has been dictated by the software. We are the ones who's going to supervise it. We're the ones who's going to correct or adjust it. But it's already been done. The hard work has been done. And the second point is the design. Still, we do nothing. We just wait. The software, the Denver design software, has already prepared the design. And you can see that STL file and PLY file are exactly identical, so that we have the same contact points, but the OBJ file is a little bit of difference, and it has ended up with a different set of contact. And what is amazing about artificial intelligence is, as we are playing with the design, correcting it, it also learns autonomously. And when we start defining the contact points in terms of occlusion, in terms of nasal and distal contacts, the algorithm keeps learning and produces better results. After we have this self-automated design process, then the next step will of course be the production. This is a multi-require ground based on the design of the artificial intelligence. Perfect occlusal anatomy, morphology, and perfect contacts in terms of marginal fit and in terms of adjacent contacts. This is what we expect from a digital workflow. Less time for adjustment, less time for preparation, planning, more time for better dentistry. In the age of 21st century, the first quarter has defined the biomimetic approach in dentistry, in everything. We pursue the nature. The nature, what we have in nature, or what we have in our vital structures, vital organs, vital teeth, they all have a purpose. An incisal edge is meant to cut the food. A molar has four cusps to chew, to grind it. This is biomimetics. Mimicking of the biology in terms of the dimensional form and also the shape. This is biomimetic approach. And biomimetic approach is not only achieved by creating form and shade, it also has to have some biometrics, as the materials we are using will define the thickness to endure the chewing forces, will define the characterization, will define the form in order to achieve a healthy gingival architecture also, which means that we have a plan. When you are doing everything on your own with your hands without measuring anything, like a very skilled ceramist, you do not have biometrics, you have your skills. But we can combine this biometric data with our skills in order to achieve more natural, long-lasting restorations. Therefore, we need a plan. And this plan can be achieved with artificial intelligence way more efficiently with the help of the supervision of a skilled dentist or a technician. This is what we get in the end, a perfect result. Let's take a look at the AI in CAD, which is going to be our very main topic today. This is Denbird. Denbird software is compared to other softwares like ExoCAD, like CereGAC, like NOAA, etc. is a very easy protocol. What you have to do is upload your scans, the bite scan, the upper jaw scan, the lower jaw scan, and everything is done by artificial intelligence in a cloud-based system, which means that you will need an internet connection, which you will need a clear and good digital file. When it comes to the accuracy of artificial intelligence design downloads, a couple of individual studies show that the morphological accuracy was the most frequently reported outcome with Denver, assessed in 6 studies. followed by design time and the occlusal contact evaluation. While most AI-generated crowns demonstrate a clinically acceptable precision, only 4 studies so far fabricated physical crowns and not conducted in validation yet, but these findings suggest that the AI-assisted crown design holds promise for improving anatomical accuracy and workflow efficiency, but the methodological heterogeneity and the lack of clinical validation highlight the need for standardized evaluation protocols and further in vivo studies. But it's possible. When we have different occlusal scenarios, artificial intelligence-driven automated design of anterior and posterior crowns under diverse occlusal scenarios, it has been shown that the artificial intelligence may not work in a very artistic manner, but can work perfectly well in the clinical manner. And this is what is important. We do not have our restorations only to be beautiful. We have to have our restorations to be working, to be functioning, to be long-lasting. In the study, there were different occlusal scenarios: the normal occlusion, class 1 anterior diastema, class 2 anterior division 1, class 2 division 2, and class 3 anterior crossbite, which would defining different occlusal scenarios. And the molar and incisor has been evaluated, and the automated computer design has been made and assessed. The assessment has been done by the surface deviation, like RNS, which means that there has been an ideal form of the end result. This ideal form has been compared to the design which has been produced by the automated computer-aided design. And in terms of contact points, in terms of thickness, in terms of the anatomical three-dimensional volume, higher the match, lower the surface deviation. But what is important is not the RMS. What is important is not the artistic end result. The importance about the clinical quality, which has been defined by FDI, is high marginal adaptation, good proximal contact points, of course the form and contour, and the final surface loss to texture, which is going to be done by the technician. These are the different data sets and types of data sets. And the idea is preparing the mirror imaging tooth, the molar and the central incisor for every single occasion, and then uploading this data to the software and to have a design. What we have seen, let's see it. On the upper right hand, the upper hand, you see the deep learning, which means the downward, and the lower hand, you have computed algorithm by three-chip automate. When it comes to normal occlusion, class 1 anterior diastema, class 2 division 1, 2, and crossbite. And also for molar area. What we have seen for the deep learning is all of the crowns for the molar restoration is in the right rotation, right angle. The buccal is on the buccal and the palatal is the palatal. But when it comes to the computer assisted automated design, which is not using the deep learning, only assisted with the computer, just like that, it recognizes the positioning of the tooth, or you define the position of the tooth. And what we see is very interesting for scenarios. We can see, interestingly, reversed positioning of the molar restorations, which is interesting. Which means that if deep learning is not in the game, the software cannot understand the positioning of the restoration, positioning of the tooth, and end up with a result which is clinically unacceptable. For the anterior zone, we see something else. We see that when it comes to the anterior zone, the deep learning now is still trying to solve the problems, while the computer automated, the computer assisted design software can do the mirroring, which ended up with better aesthetic results with computer automated design software compared to deep learning. But deep learning is also learning, still learning, and it can produce perfect mirroring restorations, which I'm going to show you soon. In functional outcomes such as marginal adaptation, form and contour quality, the computer automated group crowns exhibited, which did not outperform the deep learning crowns. Thus, we can say that the perfect geometric matching, the exact mirror replica of a given tooth alone is not the sole determinant of any clinical success. Clinically, crowns with excellent sitting, adaptation, and inclusive relationships are more likely to be successful in the long term than those merely matching geometric ideals. And also, AI is not limited only to robotic or artificial intelligence based design, it still can be adjusted, corrected accordingly by human touch. So, as we see that, comes designing using automated CAD software differs significantly in both geometric accuracy, clinically, particularly clinical challenging scenarios. The deep learning-based CAD software generally shows superior clinical outcomes and more consistent results, especially for molar designs. Of course, we can say that further software advancements are necessary to achieve better results. Very nice study by Junior Cho and friend is a comparison between the commercially available artificial intelligence-based and conventional human expert-based digital workflows for designing anterior crowns, which is very important because, as I say, the dentistry is not solely human or solely artificial. It is a combination of computer-assisted or conventional human expert-based digital workflows. In the end, human touch is necessary and it's very important. And the design study was to make a design of the anterior crown with, again, the deep learning and based workflow, two different deep learning-based workflows, and one conventional human-based workflow like ExoCAD. ExoCAD is using and providing an example from the library, but in the end, the manual design is being done by the technician by using the virtual articulator and producing human simulation. The crowns are not in a static zone, they are in a dynamic range of movements. So when they are within the range of the movements, we should expect some functional outcomes in terms of incisal path, the deviation between curves, the curve length, the mean inclination of the curve, and also some aesthetic outcomes like what the height ratio, the angle radius, the proximal contact length, and the tooth axis angle. Let's see what happened when it comes to the anterior guidance. We can see that deep learning design is more or less comparable to the computer-assisted or human-assisted computerized design, which gives us a better freedom from the start point to the end point. And when it comes to the height and also the contact length and the ratios, what we have seen is with the height ratio is more or less comparable. With the tooth axis angle is more or less comparable. The angle radius on the distal hand side is more or less comparable. And also we see that the functional path is better with the artificial intelligence. What we have as an option to make a good design, we can mirror this symmetrical tooth. We can use the library or we can copy a mock-up with Tensorboard. This is a case, a hard case, which we have prepared the design from the library. The patient needs 4 restorations. He had already lost his crowns and the preparation has been made. Impression has been done by an intraoral scanner, uploaded to the system, and the system first defined the margins without the help of anything. Okay, my friends, a good tip for any given intraoral scanner is the intraoral scanners are just like eyes. If they cannot see it, they cannot detect it. You cannot detect it. We need some eyes. We need to see the margin. We need to see the clear margins, which requires no blood, no saliva, and exact definition of the margins with good finish. This is very important. Therefore, we can use retraction methods, and we have to make a good retraction in order to achieve a good intraoral scan. Then with intraoral scan, the system, if we use PLY or OBG, which means that a color model, it can detect and it can differentiate the tooth from the gingival, much easily because of the color difference. So it's more detectable. This is why we tend to use PLY files instead of STL files, although it has been the golden standard for many years for the digital dentistry. Then the third and most important thing is supervising the margin according to the path of insertion. If we need to adjust and correct it, we can do it in a minute and then get back to the patient, do the adjustment regarding the minimal thickness, regarding the path of insertion, regarding the margin line, which will take less time and less appointments compared to sending a model, sending a physical impression to the lab to be investigated in a surveyor and correcting and redoing the process in a second appointment. Digitalization makes everything faster, reliable, and easy. And as you can see from here, we can see the indentations here, and then we can see the margin line. And the library provided us the design, and also the design process allows us to sculpt it, to change the dimensions, to add, remove, or smooth, just like making a modeling a box. And also, a very important thing is, if you take a very close look to the intral skin, you're going to see more dots, more triangles, more detailed skin in the tooth design compared to digital. As the details are, the angulations increase, the dots are increased, the point cloud is more detailed, and also we have more triangles to build mesh. But when we are doing the preparation, we should consider the technology we are going to use for making the restoration, for the production. The red lines is showing us contact with the gingiva, the papilla. We can easily transform with a symmetric scaling, or we just do some adding or smoothing. And then next, we can export the data to be milled, to be printed from any type of material. The tempered software, it gives us the option to choose, to define the parameters which are compatible for our production methodology. Mockup. The patient has been referred to me, and as you can see, she had some issues with the central incisor, the right central incisor, and the left lateral incisor, some colorization. The patient will require restoration of the 11, and also will need a little bit of gingivectomy. I provided a gingivectomy and also a freehand composite mockup to define the three-dimensional volume which we are expecting from the end result. And then we decided on how to go further to design a more triangular form or more rectangular form. Then after 2 weeks, the patient has a better and healed gingiva. So I can play with the end design to have identical central incisors. A laminate veneer preparation has been done for the left central incisor. Full crown preparation has been done for the right central incisor. And I have used my mockup. I have used my mockup to create the end design. Instead of using the library, I have used this. And also, with one click, I was able to provide not only the restorations to be printed or milled, also I could easily create a model with dies to play upon, because my aim is to make a biomimetic restoration, which will require the application of some staining, application of a little bit of ceramics with a cloth pack. And with one click, I can have all of the data, and I can export all of the data to be printed or milled. This is my triumph in the patient's mouth. Now we have even restoration with the mirror symmetry has been achieved. And with the help of stainless steel burrs and also polishing discs and rubber bands, we can create the structure, the texture, to show it more natural. With the help of the burr, I can play with all the indentations. I can create some grooves, and so I can play with the illusion of making a tooth more thinner or thicker and shorter or longer. And also with the help of the liquid ceramics, which I'm going to use upon a monolithic restoration, without having a cut back, without making and applying any ceramics, we can create the effect of the dimensional incisal halo effect and also translucency. And sometimes we use different materials which has the opalescence and translucency at the same time, which can change with firing. And in the end, sometimes with the help of liquid ceramics, we can achieve the incisal halo effect. Sometimes we need nothing to achieve this opalescence. And if we are using only the staining, we can see that we a little bit have issues about having a more natural, aesthetic, pleasant look in the incisal edge with monolithic restorations. This is therefore we are using colorization, staining, and a little bit of liquid ceramics. And this is the final restoration, which has been based on my mock-up and produced in Denver. The patient has an issue with her central incisor. I had to make a symmetrical restoration because she's going to have an implant. Even for one tooth. I tend to create a symmetrical version of the mirror image. And after that, as you can see that this young lady with high static risk, with fistula, with trauma and root fracture, and which I have planned immediate placement, has gone through another option of the Denver, which is in Studio, allows me to segment and also make the plan accordingly regarding the tissue thickness to achieve an aesthetically pleasing restoration with my immediate approach. I have segmented the CBCT and also aligned with the help of artificial intelligence with intraoral scan so that I could plan the restoration, the emergence profile, and also I could have the opportunity to plan the thickness and the positioning of my implant. As you can see that the segmentation and also defining the landmarks with the help of Denver Studio is possible. And it helps us a lot to get ready for the immediate or conventional implant restorations, implant surgeries, which I had a lot of benefit from. Soft tissue, the hard tissue, and the teeth, all of them can be segmented, can be defined by the help of the artificial intelligence. After that, we can go to a surgical planning software and implant guide planning software. And my plan is coming from Danbert, has been merged with the CBCT scan, which has been also produced by artificial intelligence, segmented by artificial intelligence. This is my plan. The implant has been virtually installed. The abutment has been virtually installed. This is the immediate application of the implant with the beyond the gap filling approach. This is what I get after 2 months with a nice emergence profile, impression procedure. And this is what I have planned, and this is what I get with freehand planning is everything. I planned everything according to the final restoration, so we ended up with a very good placement of the implant, even with a freehand, and I go for the final restoration, production, and I have chosen zirconia in this case. Is what we get as the final restoration with this young lady. We have 2 different production workflows with any given digital technology, subtractive or additive. Both are possible with Denver. When it comes to digitalization, we have different materials like glass, silica, ceramics, resin ceramics, and oxide ceramics. Not all of them are 3D printable, but resin ceramics especially are very easy to print and use as a permanent restoration. When it comes to our material selection criteria, we need to buy compatible, long-lasting, static, having high optical properties, a cost-efficient and strong restoration. And we have to keep in mind that translucency is very important in terms of having enough thickness to have a more better restoration, especially in the anterior zone. You can take a look at my review about monolithic materials, which you can use in terms of application for chairside technologies. And why I'm sharing this, because every single restoration, when it comes to additive or subtractive technologies, may require different parameters. First, starting with enough material thickness. Okay, and also the proportion. This model has been prepared and has been designed in Denver. What we are saying is, when I choose the 3D printing, it's easy to have a very good intaglio surface. But when it comes to milling, depending on which material you are going to mill, and depending on the thickness of the burrs you are using, the intaglio surface is being produced according to the subtractive technology. If you do not prepare accordingly, you will have more reduction in the intaglio surface, which can end up with less strength, more translucency. This is why we need to consider the strategy and also the burr thickness and the burr form in our restorations. whatever technology you are using should be defined, should be planned accordingly. And it's good with the network. You can use and change the materials and parameters to have a better fit in the intaglio zone, depending on which restoration, which material you're using. And day by day, we have more options in this software which are compatible, and the parameters are coming from the companies to be used, to be defined automatically for the future restoration. And all you need is to select the machine you are using for the subtractive technology, and the entire surface will be defined accordingly. A 3D printed version. This has been done by our colleague Dr. Çağlar Bursa. He had made a preparation, and we need to make a prompt for that. Let's see how it goes. We go to the restoration phase. We choose the Danford prompt. AI can classify the data. And after this classification, automatically it can detect the margins, and we can play with the margins, and we can also define the path of insertion. And as you can see, the proposal has been done by the software, and we can play with the proposal. We can change the position, we can rotate it, we can transform it, and also it's possible to play with the adding or extracting or smoothing everywhere. As it's a 3D printed restoration, the intaglio surface perfectly produced with no gaps, with no relative areas. It has been produced by Electronic, and after some colorization, the color is in the patient's mouth. Another example, this patient had a root canal treatment in his right and first molar, and also, again, my colleague Dr. Çağlar Bursa made a very nice restoration with the help of the 3D printed restoration. When it comes to 3D milling, we are going to plan only for this patient. Again, the process is the same. Making the impression, uploading to the software. The software gives us a proposal with having root contacts with the adjacent tooth and also in the occlusal way. And it's also possible to export this data to any software. I could easily get this STL file out and go into the in-lab, and I could mill it in my chairside milling machine. First comes the trying. As you can see, the intaglio surface is extremely perfect, which is going to fit. And I see the context, I check the contact with the patient's mouth, some staining, and after glutic. When it comes to implantology side, it's also possible to select the implants if they're in the library and also define the abutment accordingly. And also it is possible to create a restoration. And the near future is it's also possible to create a screw hole, screw access hole, which you can combine your mounted restoration with individualized abutment to have a hybrid restoration to be screw into the patient's mouth to provide better fit to probe and prevent periimplantitis, especially regarding the remnants of the cement. When it comes to the bridges, it's also possible to define the bridges with Danford. And the good thing about the bridges are you can change the connector shape, and also you can play with the pontic shape in order to achieve a better result, and also make a preparation made sometimes for the gingival profile for the pontics. As you can see, restoration has been produced, very strong connections has been chosen. And another example, which we are going to provide a restoration, which is going to be provisional for the term of dealing with the implant zone in the first molar, automatically detected margin lines. And when it comes to the design of the occlusal surface, with one click, we can either preserve the shape and adapt the set distance for antagonists, or we can cut the intersections and adapt set distance for antagonists, which means that with one click, you can preserve the shape and change the height of the contact, or you can provide more contact area with one click, only cutting the intersections. And also, it's possible to play with, of course, the amount of the contact and also with the connectors. Then we go to the provisional side to see the fit and also to check before proceeding to the monolithic full zirconia restorations. Either we can end up with the final restorations, or we can go for the provisions to have some idea, some clinical trying before we go for the fine. And artificial intelligence is not with us only for clinical level, it's also there for research. It's very interesting that we can obtain now from a video by a smartphone with the help of deep learning. We can do the mesh extraction. And as you can see for the D, this is the deep learning image of a given video compared to external scan, which is very interesting. The geometry and the form can be reproduced to be used for a fit test and for an angulation test. Still, it is learning. Still, we have some angular deviations and distant deviations. But as we feed up the algorithm, it gets better and better about detecting the scan bodies and the tooth, and every single anatomical landmark we are providing to the algorithm, and it makes us much easier to measure the deviations. And also, it is a quite helpful tool for future research. As you can see from here, the precision and the trueness compared to intro scanners with deep learning algorithms, they're not so bad. We have significant differences, but it is promising. This simulator environment combines smartphone videos and with a deep learning model generated full implant scans with accuracy similar to iOS, not two external scanner, but two internal scanner. Although this is not good enough for clinical application, this shows a potential that future development in economical full implant scanning. But it needs data. It has to be fed up with data to learn. If you give enough of images, you can create Van Gogh, you can create Picasso, you can create a lot of different approaches. Just like if we feed the data, we can have different clinical scenarios, we can have different morphologies. Artisanship of the artificial intelligence is increasing day by day. And it comes to research, very interesting important thing is we can also use with the large language models and detection of the image analysis. The neural network-based image analysis co-localized microorganisms and human cells on implant show that with enough data sets, it is possible to detect colonization spots, and it can predict the positioning of the colonizations. And when we compare that, we can see that as the algorithm learns, we get better in predicting the ground truth. As you can see here, this is prediction, this is ground truth. Why is that important? If we can localize and we can define the colonizations of the microbial organism only with this type of data sets, which are being processed through deep learning, it will give enormous information about the risk of periimplantitis. And also, it can be easily, automatically segmented to understand the analysis of the individual bacteria, which is very good. We all use ChatGPT, but if we teach the ChatGPT how to see, how to understand which scan body is, if we teach it, and if we can give enough of time to supervise it, it is possible to measure the angulation between the implants only with ChatGPT. And also, it has been possible to make the surface deviation view and an RMS result, the distance map with a test model and reference model only with large language models. Artificial intelligence is improving, and with the help of the data, it is not only an aid for clinical workflow, it has been an aid, it started being an aid for our research. But remember that technology is very attractive. It can create some hypes which can end up with disillusion. I love this very much with Yoda. Every technological novelty starts as triggered, like quantum computing, robotics, the digital tools, the VR. Then it creates a hype. This hype makes them to be used among a lot of peers. And as the use increases, careless use also increases. Then it creates some disillusion. After this disillusion, the believers and the persistent people keep using it with an enlightened way, enlightened mindset. Then we see that at the manufacturing, assisted documentation, e-monitoring, cloud computing become productive or will be productive in a very, very near future. Please remember that we can have disillusions. We can have unhappy moments with any technology. But if we learn how to do it properly, then in the end, we can make it very productive. like artificial intelligence design, like artificial intelligence in diagnostics, and also the 3D printing. Of course, we should not forget about ethical considerations because they are all in the cloud. If you are uploading everything in the cloud, they are prone to HIPAA, to GDPR. The patient data protection is crucial. AI-assisted treatment planning must be transparent, ensuring that patients are aware of AI is having a role in decision-making. Not all patients are tech-savvy, so we have to inform our patients. Also, we have to get their consent according to their level of literacy. If we have some issues with the technology literacy gap, we can use some simple interactive tools. Legal variability requires compliance with local regulations. AI and algorithm bias should be provided. Transparency on AI-generated recommendations and should be under human supervision. And please remember that the data security concerns can be easily prevented with implemented, encrypted, and compliant data storage systems. And if the patient is overwhelmed with the digital content, simplify presentations or only do just a mock-up to show how it ends up in the patient's mouth. The future lies in individualization for education or for treatment, using small data to prevent the big data issues, which can create some confusion, and also lies within the blockchain technology, which is going to create a bridge in between patient and the dentist and the medical professions within an encrypted system via public keys and private keys, which can only be used, the data can only be used with the permission of a patient with one click. Bill Gates once said, most people overestimate what they can do in 1 year and underestimate what they can do in 10 years. We can change this a bit to tech, and most people overestimate what tech can do in 1 year and underestimate what tech can do in 10 years. Having said that, I want to thank you for your attention, and I would like to answer if you have any questions, and I would love to thank Denver to make it possible for me to be with you tonight.